My name is Robbie Furman, and I'm with Erickson Advantage, and we're putting together some information about Medicare and how it works. So to get started, I'd like to introduce my guest. This is Dottie Crestline, and she's going to be here today to talk more with me about how Medicare works, and we're going to see if we can have a little conversation and figure it out amongst ourselves here.
I think that's a great idea, and I thank you for having me.
No problem. So what we're going to do, Dottie, is we're going to start talking about Part A of Medicare. Now, there are 4 parts of Medicare. Part A is the hospital. Part B is the doctors. Part C is what's known as the Medicare Advantage plans, and Part D is the prescription portion. Today's episode, we're going to be talking about Part A of Medicare and how it works.
Good.
Okay?
Yes.
Okay.
Yes.
So the first thing to know is that Medicare Part A has a premium, has a monthly premium that most people who live in our communities do not pay. And the reason for that is, and you yourself probably do not pay for
I do not.
Right. The reason being is you or your spouse has worked 40 quarters, which each year there's 4 quarters in a year, which means that you or your spouse have worked at least 10 years, okay? And as long as that has happened, you pay nothing for your Part A premium, okay? But the actual premium per month of Medicare Part A is $422 a month, okay? And again, that's paid for, you've already paid for that over the years when you were working, okay? So that's something right there you don't have to pay for, okay? You might know somebody, by the way, who's under the age of 65. Okay?
Yes.
Somebody under the age of 65, they themselves may have what's known as permanent disability, and that's why they too could be have a Medicare plan themselves if you're under the age of 65 with a permanent disability. Exactly. Okay.
Yes.
So the thing to know about Medicare too is what we're going to talk about today is many people have a secondary insurance, which I know you do.
I do.
Yep.
Yes.
So the secondary insurance that people have cover what Medicare does not pay for. Okay? So what we're going to be talking about again today with Part A is if the concept is what happens if you only had Medicare. Okay? Not a secondary insurance, either an Advantage plan, retirement plan, or supplement plan. If you only had Medicare, okay, what would Medicare pay for and what Medicare does not pay for, we're going to be talking about, okay?
Very interesting,
Okay?
yes.
So the way Medicare works, again, we're talking about if you only have Medicare is God forbid if a person needs to go into the hospital, okay? Medicare pays for the first 60 days at 100% minus a deductible. And what I mean by that is that a person who goes into the hospital from day 1 to day 60, they only have to pay their deductible. And the deductible for this year is $1,340.
And that you're saying that's for 60 days?
60 days, exactly. So if you go into the hospital either 1 day or 10 days, and you only have Medicare, you would have to pay $1,340, and Medicare pays all the rest. Okay. So if you went into the hospital past 60 days, day 61 to day 90, okay. If you had to be in the, God forbid, the person's not that long in the hospital, but if they were, Medicare covers everything except you would have a copay of $335 a day. Okay, and again, this is if you don't have any other secondary insurance.
And that's based on 90 days, you said?
That's based on 90 days. Then that's up to 90 days. Now, day 91 to day 150, these are 60 days. Medicare gives everybody what's called reserve days. Okay, these are lifetime reserve days. And what this means is, God forbid again, if you were in the hospital from day 91 to 150, 60 more days, Medicare will allow you to, once in a lifetime, to use your extra days. Once you use these days up, you don't get them back. Okay?
Does Medicaid kick in then?
No, not Medicaid doesn't even come into the picture yet.
Okay, all right.
It may come in at a later time, but for Medicare, Medicare basically gives each a person on Medicare an extra 60 days to use. Now, after those days are gone, so what I'm talking about is from day 1 to day 150.
Okay.
That's what Medicare allocates for a person.
Okay.
After 150 days, Medicare pays zero. Okay? Medicare pays zero towards your hospitalization. Okay? Now, here's where your secondary insurances come in.
Yes.
Your secondary insurances pick up more days. Okay? Most secondary insurance plans will pick up for the rest of the year, for God forbid. Okay? It's always important, as we're talking today, and this is the reason we put these presentations together, is for more people to learn about both Medicare and
the secondary.
Right.
Yes, I can see that.
Too many people I've spoken to very confused about the whole thing, how it works. Okay, so that's why I'm so happy we're here today to talk.
Yes.
So again, with the hospitalization, it's the best to always find out what does your secondary cover above and beyond Medicare.
Yes.
Okay.
Yes.
All right.
Uh-huh.
Okay. So the way it works is to understand with a person, God forbid they need to go into the hospital. Once they're out of the hospital, they go into what's known as skilled nursing care.
Right.
Okay. And in our communities in Erickson Living, many of us we have our skilled nursing.
Correct.
Or we have our care centers, as we talk about.
Yes.
Okay. Now the way it works is, and this is the rules of Medicare again, if you only had Medicare, days 1 to 20 are covered at 100% by Medicare. Okay. What you then need to do is to check with your secondary on what you have to pay for days 21 to 100. Okay? Some plans will cover 100%.
Yes.
Some plans will cover a percentage. You might have to pay a copay, or you might have some out of pocket. Now, here's something very important to know, is that after 100 days, during the same benefit period, and we're going to talk a little bit later what is a benefit period, but if you hit 100 days in the same benefit period, Medicare pays zero afterwards. And the one thing to know about Medicare and your secondary insurances,
yes.
Medicare and your secondary insurances are like tying a string to your shoes. Okay? If the left foot goes forward, the right foot follows. Meaning, if Medicare pays for it, the secondary will also pay their portion. If Medicare does not pay for the first portion, that means your secondary, they do not pay it either.
Okay.
So that's another thing you need to look in your plan. Now, some people do have retirement plans or other type of plans that do offer extra benefits that go beyond Medicare. And that's something it's very important to know, again, is to make sure, what does your plan cover?
Yes.
Okay?
Yes.
And we're going to talk in just a minute about, in fact, we're going to talk about it right now. I mentioned this term benefit period, okay? Now, a benefit period, this is very important to understand, is a benefit period is a time when you first go into a hospital. Okay, let me give you an example. Let's say New Year's Eve, you were having a great time. Okay, went out for a party, and let's say the next morning on the brand new year, January 1st, you wake up not feeling so well. Okay, you pull the cord in your apartment. Okay, the EMTs come down and they take you to the hospital. Okay, if they admit you to the hospital, that's day 1. Okay? Now, you may only be in the hospital for, let's say, 3 to 5 days. Okay? And then you go to the skilled nursing. Okay?
Right.
You leave the hospital, go to the skilled nursing. You're now at day 6 in the skilled nursing. Okay? And you're there maybe for 5 days.
Okay.
4 or 5 days. So let's say now you're there on day 6. You're there day 6, 7, 8, 9, and 10. Okay? In the skilled nursing. And then you go home. Okay? And you stay home. You don't go back to the hospital. You don't go back to the care center. So if you stay home and out of the hospital and the care center for 60 days, your benefit period starts again. Okay? So if you were, even if you were 5 days hospital, 5 days skilled, you went home, and then you didn't come back to the hospital for maybe 100 days. Okay, 3 months went by, and then you went back into the hospital for something different or the same. That's a new benefit period. Okay? Now here's what's very important to understand is some people will go in the hospital, same exact scenario. January 1st, they went into the hospital, and they went to the skilled nursing,
Okay.
and then went home because maybe they had a little bit of pneumonia, let's say,
Right,
God
okay.
forbid. Okay? 2 weeks later, after getting home, they went home on the 10th of January. 2 weeks later, they, God forbid, they sprained their ankle or broke a leg or whatnot and have to go back to the hospital. Even though it's two separate issues, pneumonia was one and broken bone was two, even though it was less than 60 days, they're still in the same benefit period. So when they go back to the hospital, that's day 6, that's day 7, okay? Doesn't really matter too much how many days in the hospital you're going to have.
Okay.
What really matters, and this is very important, is those skilled nursing days. Because when you hit day 7, day 8, day 9, let's say you're in the skilled nursing for another 2 weeks, 3 weeks, those days keep adding up. And again, now it's maybe you spent 3 weeks in the skilled and you come home.
Right.
Now you've had 25 days gone. And let's say 3 weeks go by again, and you have to go back to the hospital for something different, or maybe there was a problem with the brake and they have to reset it. And you go back to the skilled, again, if there's not 60 days, now you're at day 22, 23, or whoever it is. So it's very important, if you know anybody or this might happen to you, is very important to keep a close eye on your own days in the skilled nursing. Because once you hit 100 days
Yes.
in the same benefit period, Medicare stops paying. And your secondary also, too, will stop paying. Okay?
Aha.
So this is something very, very
It
important.
is, yes, and I can identify with that. I mean, it's just from things I've heard. Yes.
Exactly. It's a little confusing because, again, I've spoken to some
Yes.
people who said, oh, I thought at the end of the year it resets itself.
No.
No, it doesn't. It has to be you're out of the hospital or the skilled nursing for 60 days total. Okay? That's 60 days. Once in the, you could be more than 100 days in skilled.
But you can be out and back and out and back, and you do, but you accumulate that.
Right, you can do it, but it's got to have a 60-day window.
Okay.
In between.
In between.
Some people might have gone 100 days in the skilled, which is about 3.5 months. They
Yeah.
come home for 2 months. Then they need to go back in, God forbid, for that many days.
Right.
As long as you have a 60-day window or a spacer, then when you go back in, the button is reset.
Okay.
Now you're at day 1 again, day 2, day 3. So that's something very, very important to understand how Medicare works with the skilled and what is a benefit period.
Yeah, I've got that. That's very interesting.
Yeah.
Very.
No, it's very important to know is because
Yes.
I've spoken to people who, and this is the word, a lot of people will use, well, I just assumed. I heard from my friend.
Right.
They told me, each situation with a person in the hospital or skilled nurse, it's like your thumbprints. Everybody has a different thumbprint, and everyone has a different scenario that goes on. So that's very important to do your own research on your own health insurance and to understand how Medicare works with your health
This
insurance.
is so informative to the residents, there's for sure.
I agree with you
that's
completely. It's so important
Very
to know.
interesting.
Okay. One of the things too is we're going to talk about under Part A of Medicare. What's also covered is home health care, which we're going to talk about in just a minute, durable medical equipment, hospice, which is covered under Part A of Medicare,
Okay.
and also mental health inpatient stay. So the first thing we're going to talk about is home health care. Now, this is something very, very important to understand. We talked about a person might go into a hospital. From there, they go into a skilled nursing facility.
Right.
Okay. Then from there, they're going to go back to their apartment. That's the goal, is to get a person back to their apartment. Now, if let's say a person who's going back to their apartment still needs some medical treatments. Let's say the person needs to have an injection, done each day. That's the doctor is the only one that can administer it, or a trained nurse, a registered nurse, or a bandage needs to be, a dressing needs to be changed. So what will happen is the doctor, and approved by Medicare, will send in a certified home health care person.
Right.
Okay? So it's a registered nurse or a doctor who comes into your home, which does one of those things we just mentioned, changing a dressing or administering some drugs or whatnot. Again, that's covered by Medicare, and that's covered at 100% under Medicare. So you pay zero for that.
Can I ask you a question?
Sure.
You said when they go from the hospital to skilled nursing, to skilled care, and then go back to the apartment.
Right.
How about if they went to the hospital and then went directly
Correct.
back?
That's a great question. Exactly. That might happen also. Sometimes it's when the doctor decides is the best care would be, you know what? Let's send this person directly home.
Yes.
So that can happen. Exactly. And you just wait, you bypass the skilled nursing 100%.
Okay.
Exactly. Now, here's the important thing to know is when the doctor orders the certified home health person to come in, it's not going to be for that long, maybe. Because here's where the problems come in. It's got to be approved by Medicare. It's got to be medically necessary for that the certified home care person to come in. Now, that certified home care person who comes in might say, you should have somebody here every day this week.
24/7 or something.
They should come. Now, that's something different, which is it's a little confusing. Home support, what we have in our communities,
Correct.
that's more becoming self-pay. Medicare does not pay for home support. And what a home support person, and it's very important to have this, but people get a little confused because with certified home health, it's paid for under Medicare. Home support, you self-pay out of your own pocket. And under Medicare plans, as I said before, if the Medicare shoe doesn't step forward, then the secondary doesn't step forward. Okay? So with home support, Medicare does not cover that. People may have an extra policy known as, what is it known? I'm forgetting myself here. It's what is it called? It is called
like a subsidy or subsidy.
It's called long-term care. There we go.
Oh, yes.
So long-term care policies a person may have, that will cover the home support, maybe. Okay? But there are other policies that cover home support, not Medicare. Okay? So that's something very important to know.
Yes.
Is if you do have Medicare sending certified home health, it may only be for one day. And sometimes, in fact, the person who comes in is training a family member, saying, okay, let me show you how to, the person maybe broke their hip. They're training the family member how to help the person stand up. But Medicare is not sending somebody every day to help stand the person up.
Okay.
They may only come once, maybe 2 days, but that's something very important.
Yes.
I talk to a lot of people and they get a little confused about. So
Yeah,
that's
you're right,
noted.
yes.
And again, what's covered is known as home health care or certified home health.
Yes, that's
Okay.
very interesting.
Okay.
Yes.
Another thing that's covered under Part A of Medicare is what's known as durable medical equipment. Okay, and durable medical equipment are things like a wheelchair, crutches, oxygen. Okay, and it's always very good to check with your plan, meaning your secondary plan, to see what is covered. Now, Medicare generally covers 80% of a person's durable medical equipment.
Okay.
Okay? It's important to find out what your secondary covers. Okay? So that's important for oxygen tanks, again, a hospital bed. Okay? So again, it's all covered under Part A of Medicare with your Medicare and your secondary. Okay? You have to find out what, or if you
How
have
much?
how much exactly.
Okay.
So it's very important to learn about that.
Very interesting.
Now, the one thing I always, it's very important to learn about what is hospice?
Yes.
Okay. Now, many people I know in our communities, unfortunately, have heard, well, not unfortunately in a bad way, people have learned about hospice.
Yes.
And hospice, what happens if a person does need hospice, is in a hospital setting generally.
Yes.
Somebody from the staff in the hospital will come over to a person and maybe tap you on the shoulder and say, we'd like to talk with you.
Yes.
And the question usually is, would you like to have your loved one go on to hospice?
I do think some of the areas like we have here do have that connection.
Right. And it's my recommendation is the time to learn about what hospice is not in the hospital. The time to learn about what hospice is before a person ever
Yeah.
needs to go, even
Yes.
for ourselves, because there are people who choose not to go on to hospice,
Right.
and other people do choose. But again, this is a very important thing as I'm speaking to the listeners or the viewers right now, is that the best thing to do is to contact your local hospice agency in
Yes.
your area and just get some information about hospice, okay?
Yes.
One of the things that people have also made a kind of a slight mistake is I've talked to people and they said, oh, my loved one is going on to hospice and now I don't need to have any other insurance. The problem is that people sometimes cancel their other insurance. Unfortunately, and I'll tell you what the problem is hospice covers all end-of-life scenarios. So pain management, medication, and again, they cover, what I mean is in the hospital setting, they cover a lot of it. They don't always cover, let's say if you're going back to the home and you have to modify your home, not all of that is covered, but that's again to learn more about what your insurance covers. But here's the biggest thing to know is, let's say a person is diabetic, okay? And they're still going to be taking their diabetic medicine.
Yes.
And see, that's the important thing. Hospice doesn't cover the diabetic medicine, okay? So that's where, again, if you cancel your insurances, you might be paying 100% for your diabetic supplies and medication.
Does Medicare differ in different states? Is it the same?
It's interesting. It's a great question. Medicare is generally the same in almost all of our states. There are some states that are known as waiver states, and the people in places where we have communities, Massachusetts, okay. There's also Wisconsin, and I believe it might also be Hawaii. But they have a different type of Medicare plans.
I thought I had heard that somewhere. Yes.
Yeah. But generally, Medicare works the same across the whole nation. Generally. But again, my biggest recommendation is for people to learn more about what hospice covers and what hospice does not cover.
Before they.
Too many people. Again, I've spoken to some people where they said, my loved one fell out of bed and broke a hip, and we brought the person to the hospital. And hospice says, again, we don't cover that because not end of life.
You're right.
So that's where you might have a large hospital bill. Or remember we talked about that deductible?
Yes.
That day 1 to day 60, remember we talked?
Yes.
That you might be responsible for. And people said, but I thought my... So it's very important to learn the facts about hospice. Okay.
Well, I'm learning a lot, Robbie.
Right. And the last thing is that Medicare does also pay for what's known as inpatient mental health. Okay. And what it is each person on Medicare has 190 lifetime days. So if a person does need to go into a mental health hospital, Medicare gives 190 days per lifetime per person.
What about a memory care unit?
That's different. What we're talking about is more about if a person needs, they're having some mental health issues, and they need to go to a hospital, not a care center. That's what we'll talk about real quick here.
Yes.
But it's a hospital setting. Okay, we're talking about regular hospital. So that's a mental health hospital that Medicare allows for 190 days. After 190 days, you were talking before even about Medicaid.
Yes.
There's a chance Medicaid might come in to help pay for that person's stay in the hospital. But that's, again, something I recommend for a person to do some research on
Before
themselves.
they...
Yep, just to learn what it is.
Yes.
But that's where it gets a little confusing too, is to know that the care centers that we have in our building, we have skilled nursing,
Yes.
we have assisted living,
Yes.
and we have long-term care.
Correct.
And it's very important for people to get a good feeling or understanding of what Medicare covers for each of those different levels, okay? So the main thing to know is, as we're wrapping up here right now, is Part A, again, it covers your hospital. Part A also covers the skilled nursing facilities, okay? So that's pretty much your Part A of Medicare, okay? And our next show, what we're going to be talking about is more about our Part B of Medicare's, which is the doctors and
Yes.
the outpatient facilities, okay? So we're going to be doing that next. But for the viewers of our show, to learn more about Medicare, or if you have questions about the insurance called Erickson Advantage, available right there in your community, take a look at the information on the screen here, and please contact your Erickson Advantage representative for more questions and answers.